And this is David Bruce Leonard from the Earth Medicine Institute here with Sam Coffman at the Human Path Herbal Medics Academy in Taos, New Mexico. I've been here for a week and it's been incredible. Tell us what you're doing here, Sam.
Sure. This is called the Home Course, Herbal and Off-Grid Medical Experience, and it's basically a hands-on 12-day immersion into medicine in an austere environment that incorporates and integrates herbal medicine with basic emergency medicine that's orthodox or allopathic.
Right. Yeah, this is just an amazing experience. We've got, 14 students?
Yeah, we have a total of 14 students.
14 students, yeah.
Like at least one person auditing and kind of helping out. We have, four instructors really, if you count my wife Suchil as well, for part of the Wilderness First Responder. It's divided into three-day segments for the most part. The first 3-day segment is what we call the Medical Advance Party, which is, think of medical reconnaissance for any organization that wants to provide health care for underserved communities, whether it be in a post-disaster environment or a rural or any kind of an austere setting where there may not be higher care at all. The second 3-day portion is the Wilderness First Responder, which is the capstone for what all the students have already done, either online or on site, in two other thirds of the 3 thirds, basically. If you can think of it like there's the first third is Wilderness First Aid, the second third is Advanced Wilderness First Aid, and the third or the final third is Wilderness First Responder. And that we have to do in person no matter what. It's Wilderness First Responder, we have to do it on site. And so that's the second 3 days. And then is when Dr. Pearson, MD, steps in and does his piece on austere medicine techniques. And you've been working on, suturing and wound closure and infection management. You'll be doing airway, you'll be doing chest tubes, you'll be doing austere stuff that is something that you can gain a lot of confidence in a very short amount of time, where you might have an emergency situation that you were the only higher care and there was no other way to deal with things. So we kind of take it beyond the WFR. Then the WFR is always, do we evac, do we not evac? Okay, if we're going to evac, how do we get them out and where's the higher care and how do we stabilize them and prevent any further injury or hopefully even, help them become less injured or less, traumatized or whatever, whether it's environmental or trauma or medical, and get them to higher care. And then the austere program asks the question, well, what if there is no higher care at all?
Yeah, so we've been, like Sam said, the first 3 days were just, Wilderness First Responder, and that was very intense, very cool. And Dr. Pearson's here. And Sam and Dr. Pearson were both 18 Delta Green Beret medics.
That's correct, yeah.
Sam is a specialist in herbal medicine. He's and he's been doing that for 30 years. And Dr. Pearson has been a surgeon for since the Han Dynasty. Huh?
Yeah. So Steve came through the 18 Delta course, Special Forces, aka Green Beret Medic course, about 10 years before I did. And then he went the orthodox route. I think he became a paramedic. He went then from there to med school. He's family practice and emergency medicine board certified, but he has a lot of surgical experience.
So you've been an herbalist for 30 years.
Yeah.
And you're now an acupuncturist.
That's correct. Yeah. I got my my master in science in acupuncture and oriental medicine, and I'm finishing up. I've got one more NCCIOM board exam to do, herbology. Ironically, I've done all the other 3, and that's of course the easy one really for me. I feel like. But I've been too busy. This is just 2023 has been insane, getting all of this brand new property ready and all the infrastructure to be able to do this course. It's been huge. And this is the first time we've done a course of this magnitude on site.
Yeah, well, it's going amazingly well. It really is. So I know you studied Chinese herbs from a scientific perspective for many years, and Western herbs and Chinese herbs.
Yeah.
And then you went to acupuncture school. What has been your takeaway? Because I know you're grounded in science and in Western herbalism. What's been your takeaway after acupuncture school on the whole?
Yeah, so the takeaway, a lot of really good things have happened, I think, by doing that. That experience has been wonderful because it's added a whole new paradigm, really, to medicine for me. I'm not going to, I would not extol the virtues of American acupuncture schools and how acupuncture works here, because it's 80% needles and 20% herbs at best. Big part of our program is advanced medicine making, multifractional extractions, and how do we really look at what we're getting out of that herb, and how do we get a full profile, constituent profile out of the herb, or if that's what we're going for, or a part of a profile if we're not. And so I think there's a lot of tradition in Chinese medicine making that is fantastic. It's absolutely amazing. And so the Materia Medica, the herbology and the formula Materia Medicas that are, the standard out there are just fantastic,
So Sam and I have been discussing the possibility of having Sam do a class for Chinese medicine practitioners on the scientific applications of Chinese herbs, which is one of the main things that's attracted me so much to what you're doing here, in addition to the survival and the austere medicine stuff. Would you talk a little bit about that? Because I think that is brilliant, and I think it's really valuable and what's needed now.
Sure. So I think where this goes back to is maybe when you go back a dozen years or even 15, 20 years, it was impossible to find really good data on any herbs that was ever done in a Western capacity. Sometimes you'd find some stuff out of European testing and labs, because I feel like Europe is a little further ahead. But in North America and in the United States, any research that you saw done on herbs was always done with the caveat that this doesn't work, and when we're done, we're going to tell you at best, well, maybe it does work, but it needs a lot more research. But if you go to China or you go to India, where they've been using these folk medicine to TCM to folk medicine to Ayurveda, and you look at the research, it's done from the perspective of, we know it works, it's been working for 1,000 years, but how does it work? And so this is where I really found the data, and this is why I started turning to growing and working with, honestly, with TCM herbs, was from that perspective. Now, I'd always been interested from an energetic perspective. Peter Holmes was probably one of my first herb books 30 years ago, and to this day, it's probably the only book I reference on a regular basis.
Yeah.
And I think what he did with that was fantastic, and I think I would like to take that and move it to the next generation. I hope that would be one of my biggest goals as a writer, is to do that one day. But that spoke to me a lot on the energetic level, but it didn't answer these questions that I was coming at from a Western side. And so where it first really started happening was what I call neuroregeneratives, or herbs that are neuroregenerative, in the sense that they regenerate and support myelin sheath, surrounding the nerve tissue, the nerve cells. This became something that I found out empirically worked incredibly. I had one patient, it was kind of like that kind of, sometimes with herbs I've had these, like, there'll be like this doorway, there'll be like one patient where it's like, oh my God, it's just so dramatic that there's something there and you have to continue then. And I had this one patient that had spinal meningitis, like viral meningitis, about 15 years prior, something like that, 12, 15 years prior, and it became bacterial meningitis.
Wow.
And she was in the ICU for something like almost a year. And she literally, I think she died twice, like they brought her back twice. Just horrible, horrible damage, to her nervous system. And she had like probably a dozen years or more of misery, that she'd gone from specialist to specialist to specialist, neurologists and so forth, been diagnosed with everything from Bell's palsy to migraines to, to just trigeminal neuralgia, and on and on and on. She had never slept for something like a decade. She had not ever slept more than 2 or 3 hours at a time. Like, she'd wake up and she couldn't, in the pain or whatever, it was pain at one point, and that changed to just anxiety, depression, all these things. They were just to me, seemed very obvious. They were probably neural inflammation related, or nerve damage related to the meningitis. And so I remember asking her, what did your doctors do about your your original case of meningitis, and how did they look into that? It's like, oh, they didn't really, they just, like, after about 5 years after, they're like, oh, that probably doesn't play a role. I'm like, well, of course that plays a role. I mean, it has to, right? I mean, that kind of damage. And so that was when I first started working. I was like, okay, I've been working with these herbs. I just kind of started. It was, again, about a dozen years ago. And it's like, I'd really like you to try these. And what I'd like you to try, because I've done a lot of research on some of these herbs that were used in Ayurvedic medicine as nausea oils, right? NASYA, that is inserted through the nose. And there was some really good and interesting research about ashwagandha, for instance, and how it inserted through the nasal cavity intranasally as an oil and just kind of rubbed into the mucosa, and then basically going into the circulation directly in that part of the body was turning around, was like having great success with that for like early dementia, early onset Alzheimer's patients. And so I thought, well, what if we tried that? So we tried this nausea oil approach, and of course I gave her some internal formulas as well, using a lot of these neuroregenerative herbs.
And some of them were Chinese.
Most of them are, yeah. So Acheranthus bidentata, Cornus officinalis, Alpinia, Oxyphila, not Galangia, but Alpinia oxyphila, where we use the seed.
Scutellaria?
No, I didn't use Scutellaria bicalensis, although that absolutely, for inflammation, is a great one to put in there, for sure. Now, they're using injectable forms sometimes in these, too, which I would love to get into. And in New Mexico, you can, as an acupuncturist. You can get into injectables, which I think is amazing.
With phlebotomy? Really?
Yeah, like being able to get an injectable form of the herb and actually put it into the bloodstream directly.
Fantastic.
Yeah, and China does that a lot. There's a lot of that going on, right?
And you have to be careful,
You have to be very careful, and you have to have an injectable form in the first place. But yeah, that's what I love about New Mexico is you can get certification to be able to do that as an acupuncturist, too. So anyway...
so your patient?
So yeah, she takes a nausea oil and the oral form of this and goes home. And I told her, hold it sublingually and let's try this and just see what happens. And she calls me like 3 days later and she's crying and she says, I just slept for 8 hours. It's the first time I've slept for 8 hours in almost a decade. It's like, you can't believe like how I feel today. And I was like, okay, we've hit, pay dirt on this, and let's, and we continued with that, and we improved her condition vastly over the period of the next year or so, 6 months to a year. So that was like one of those flagship, like, okay, my gosh, you're onto something here, Sam, let's do this. And so as I continued, another big aspect was mitochondrial support, like how can we increase, and this is something that Kyla Helms, who's another MD on our faculty, who is a functional medicine doctor. And so that was all about, her working with so many people that, well, all the way from some of the things she was working on with chronic toxicity, all the way through long COVID recently. She's, talked over and over about trying to support mitochondria and how much that would help. And so I started doing a lot of research on that. And lo and behold, tons of Chinese herb, a lot of them are the same neuroregeneratives, by the way, that I mentioned, that are also mitochondrial supportive. So in other words, they increase mitochondrial production at a cellular level in different mitochondrial cells, or in different mitochondria, in different cells in the different organs. So like sometimes you might find an herb that works really well for cardiac cells and mitochondria and cardiac cells, and sometimes it might be for another different organ system or just a different organ. So there is a connection there between Chinese herbs being used from a Western perspective, and then deeper than that, when I was going through school and I was in a clinic, I remember I had an instructor who was from mainland China, and she'd been an acupuncturist for 20 years or so, and was very experienced. And I remember her. I was at the first trimester, maybe the first 2 trimesters of our observation, right? She just observing and doing paperwork and things like that. And she was getting these patients in that were like perimenopausal women who have all of these, what I consider to be an epidemic. And I would get them in my herbal clinic all the time, my student clinics. It just seems like an epidemic of women who are perimenopausal. They have unexplained weight loss or weight gain that they can't get rid of. No matter what they do, no matter how they exercise, how they eat, sometimes blood sugar issues, maybe type 2 diabetes, like early onset, or like the first stages of that, thyroid issues, cortisol issues, just constantly this pattern. And working with Western herbs, it was always just kind of like playing whack-a-mole. It's like, oh, well, let's work on the cortisol. Okay, well, let's work on the thyroid. Well, let's work. And while that can be mildly successful, is by no means the right way, in my opinion, to approach that. Well, I didn't have another answer, but this particular physician / teacher, acupuncturist, Dr. Tan, she treated it like it was low-hanging fruit. Like, oh yeah, that's easy. Like pulse tongue, No,
Like
a little bit of a
Jiwang
yeah,
Tong
it's
and
like
all
here's,
that?
here's what we do,
Yeah, yeah, yeah.
and she would be like, okay, for you, this is what we need to do. And I started seeing these patients coming back after 4 weeks, 6 weeks, and saying, wow, I'm really getting better. My blood work came back, from the thyroid. My thyroid hormones seem to be more normal. And I was just like, what are you doing, And she's like, oh yeah, well, this is simple. This stuff's easy. I'm like, this stuff isn't easy at all. What are you talking about? But it is so much. It works. So I've been kind of creating this layer concept for right now, where I've always had this onion layer concept in the clinic, but now I have 2 extra layers to it. One, the surface layer is, what can I do for a patient that comes into the clinic that will bring them back in a week or 2 to say, you know what, I'm feeling better, I'm not going to try to, yeah, exactly, treat the branch.
Yeah.
And it's like that. This is the key, because you see a lot of Western herbal clinics. They want to take like an hour and a half to 2 hour intake. Okay, now you're gonna have to go off gluten, and you're gonna have to go with dairy and sugar, and you're gonna have to exercise 3 more times a week, and you're gonna have, and it's like they walk
these
away.
Mantras,
and it's like,
right?
yeah, and it's like nobody's gonna come back from that. Nobody's gonna do that. And if they are, it's it's because they have so much money and time that they're just they're bored. So and we work with so many people that are either underserved or there's these different communities that each of them have their own kind of epidemiology, right? It might be because they're in a food desert. It might be because they're just in food desert with just sugar and alcohol and or these issues around what they're actually eating. It might be because they're exposed to just a huge amount of stress. We had one community that we worked with where the food that they were making, it was all homemade food, but it was so rich with dairy. This was not in this country, it was in a different country. And the women were in such a misogynistic culture. And it was just amazing how much the women were treated almost just as like breeders. Like once you can't have children anymore, you're pretty much useless to this society. A closed religious community, really, is what it was. And you just saw the same epidemiology over and over and over again with every single woman that came into the clinic. So, and that was an exaggeration, but in Nicaragua one time, it was just like every man that came in, like 70% of them had kidney stones.
You said that, right.
And it is an epidemic there on that part of Nicaragua. And then I talked to a doctor there, and he's like, yep, it's because they work all day in these sugarcane fields with nothing but fertilizers and pesticides in the water, with bare feet, and they're working 6 days a week. Oh, and they also always had like whatever their primary arm was from the machete. They just had all kinds of muscle, rotator cuff issues and so forth. So anyway, and then you'd be on volcanic soil on one side and the ocean on the other. The water is horrible. Anyway, so you're going to find an epidemiology, is my point, in every area you're in, right? Cultural epidemiology, I like to call it.
Hang on just a second. So just to be clear, the Human Path does remote or austere medical clinics in different places all over.
We used to do them here and abroad. Now we're focused more on indigenous communities here, especially like Navajo Nation and so forth, which is part of why we moved here to Taos as well,
right?
To be able to offer that in a local area. We stretched ourselves a little too thin going out to places like Nicaragua and Mexico and even out to the, to like West Virginia and coal mining areas and such, because we just didn't have the bandwidth to be able to follow up. And you really aren't treating any community until you can follow up.
Right.
So here we can follow up, and that's part of the vision here going forward as well, is to be able to do that.
So in terms of the future, wait, so
what I was going to say,
yeah.
I'm sorry, was that, so then Dr. Tan, and this is back to the story of what acupuncture or what acupuncture and oriental medicine did for me, is that it allowed me to create this kind of layered approach to where the symptomology from a Western perspective, and then maybe the branch from a Chinese perspective, TCM perspective, and then the deeper like functional medicine, cellular level from a Western perspective, and then the deepest to me is the energetic from a TCM perspective. Like just so you're really going through kind of branch, rhizome root or whatever.
It's kind of like a lasagna.
Yeah,
layered.
right, lasagna. Yeah, that's good.
Huh.
And then, man, I'm telling you, this is just like I have had. I don't know if it's just timing or whatever, but since I started the teleclinic up here, we don't have the clinic open yet, but I have the teleclinic open. I had just had one incredibly complicated case after another, and this process of using, what I've learned in TCM, along with and integrating it with. So where I'll have formulas that might have some Western herbs in them. I might have an entire formula that's mostly Western herbs, maybe, but I might also have a formula that's got a couple of Western herbs in it, and maybe 75% of it will be TCM herbs. because it's just very obvious. You know,
Are
that they
you
have
thinking
spleen cheating.
energetically, like
Yes,
chi
so
stagnation
absolutely.
and
So,
damp
like,
heat and all that? Yeah.
Yep. So we have like obvious spleen chi deficiency here, or obvious kidney deficiency, or whatever, may be part of it. But there's also some stuff going on here that I can absolutely treat more from a symptomatic approach. That'll be very effective, you know.
Mm.
So, and it's interesting because then you start to see the crossings of these. So, for instance, right around here, up here, we have green gentian, Frezera. I forget the species name, but it's a different genus than green gentian, Gentiana lutea, but it is very, very similar in its medicinal, taste and its medicinal qualities and everything. And same family, of course, but different genus, different species.
Ranunculus? Yeah, whatever, it doesn't matter.
No, it's not. It's Gentianaceae.
Gentianaceae, yeah.
Yeah. Frezera speciosa is the green gentian here. Michael Moore, used this, the root and the leaf and so forth. So I found that the leaf of the green gentian, for instance, is very similar to wafer ash, which is Trifolia, or Petilia trifoliata, and they're very similar, except for the wafer ash is actually in the citrus family, and it has that kind of mix between citrus and berberine to it. It's got that kind of bitter, but it's also got the very the citrusy kind of feeling to it too. So I found that like doing a 25% orange peel, dried orange peel, with 75% green gentian gave me this very similar equivalent to wafer ash. And so, that is a great one to use both as a liver support and, a cholagog, but also a choleretic, and also something to just help with general, digestive as a bitter that you can use, but it's not as cold as, say, and as descending as, say, using gentian, in Chinese and TCM. And so you can take something like that that's more gradual, and you can work on kind of the superficial, more symptomatic process, and then you can say, okay, after a week, like, let me know how you feel. And be like, yeah, this is feeling a lot better. My GERD is not affecting me now. And then you can say, okay, but we're not there at the root yet. We have this issue of chronic diarrhea or whatever, just chronic loose stools, and just never the fatigue. And I looked at the tongue, and there's teeth marks on it, and all of the things that might send us in the direction of something like spleen chi deficiency. And so as you start to mix those two around, then there's also deeper aspects to what I'm learning about TCM. And I'm by no means, I don't have the experience that I need yet in TCM. I'm not saying that I do. But as I approach it from the Western perspective, it's sort of like having a lever, that you can kind of like leverage, that you can push to be able to get a little bit deeper into some aspect of a person's overall health picture. And in that process, it helps you with the syndrome differentiation from a TCM standpoint, while at the same time giving you symptomatic relief from a Western standpoint. And then you can also mix in the functional medicine piece of that as well, which I think is not necessarily as deep as the TCM energetic perspective, but it all fits. There's nothing. It's very rare that I'll see something where it's like, oh wow, these are like totally at odds with each other. It's always exactly the opposite. They almost always dovetail into each other.
Yeah, well, there's a limited number of signs and symptoms that humans come up with.
Right.
And then, our patterns of illness and health are similar all over the world. So, yeah, that's awesome.
Yeah, I think that, I read something when I first started in acupuncture school, or wherever that was, 5 years ago or something, I was reading some different just texts by different Chinese or TCM doctors who had come over here from Taiwan or mainland China and would say something, had things to say about American health. And I remember reading something by someone who was like a very experienced Taiwanese neighborhood doctor. He'd been over there practicing for like 40 years or something. He came over here and he's just like, I cannot believe all of the kind of almost, what did he say, like all of the layers of disease that are in Americans that that I have to try to decode coming from a TCM perspective. And I totally understand that coming from a TCM perspective, but here's the thing, I think that it doesn't work sometimes to just only have one perspective on any part of that medicine at all.
Totally.
You have to have different perspectives in order to lever your way into it, right?
Exactly, yeah. That's awesome. Yeah. So we've been talking about doing a class for acupuncturists, weaving into the, probably people that are more experienced, but weaving these things in, because I'll use traditional formulas and then I'm always modifying them. based on other pieces of data and stuff. So we're considering doing that. Where are you going?
In terms of the school?
The school and your life, and in terms of the trajectory, because this has been a trip for you, and where would you like to go, and where do you see all this going?
Yeah, I think that this, having the home course here, the 12-day course, which took such an immense amount of work to put together and get everything ready for it, was kind of a good way to kind of stand on our 2 feet and say, okay, we're here. I see us continuing to delve much further into austere medicine. I see myself reaching out. I have some things already planned that are happening that are very much, I've been welcomed with open arms into some of the special operations educational communities, to where I can start to integrate herbal medicine into that special operations medicine idea, whether it's from the standpoint of just college level education, or whether it's military level education. I think we need to do some things to be able to increase our credibility for the whole wilderness first responder thing. That's an entire area that is kind of dominated by a few players that were here, that got here before everybody else. I mean, I've been teaching WFA for probably close to 30 years now, but actual WFA cards and so forth maybe for 15 years. And these folks this is all they do. And for us, it's like, it may not even be 5% of our revenue. But,
right.
So it's not like it's a big thing, but I feel like I want to make sure that our credibility as a WFR provider and a WFR instructor level
that's wilderness first responder.
That we need to be there completely, and in the state of New Mexico. So there's some accreditation stuff I'd like to really work on. Excuse me. And even, accreditation around maybe GI Bill eventually. So there's a lot of credibility. I credit, it's like credibility in the sense that we can say we have the recognition.
Getting credentialed.
Getting credentialed. I think that's a big part of what we're doing next. And me getting my Doctor of Oriental Medicine here in this state is a big part of that, because they're treated almost like primary care here. It's wonderful. This is a great state for acupuncture. So there's that. And then there's our clinical program, which we're branching out, and I'm going to open up this clinic to be a place where students can come. I've had one intern so far that I've worked with up here as both in the apothecary and in the clinic, and it was a fantastic experience. I'm not quite ready to really be able to do this full time, but at some point we'll be able to open up to where we have students rotating in for internships as well.
Cool. So you do rounds and stuff like that, clinical
Exactly.
rounds? Yeah, that's great.
Yeah. We have we still have the family medicine program, which is all about prenatal and postpartum and pediatric, and we're going to expand that to geriatric care, which has been largely Katia, but Mel Bailey is stepping in and doing a big part of that as well. And then we have the advanced medicine making, the apothecarist program, and that's going to continue to expand. I'm putting out more multifractional stuff. I've got a book on the way for that. I'm finishing another book for Story Publishing, which is actually survival gardening, which is away from where I want to really be writing, but that's the next one coming out. And there's the third one that I have on contract with them. None of those two aren't really herbal, but I have like an entire, at least 2 or 3 more herbal books that I want to put out that are going to be very much a unique take on herbal medicine, whether it's from a clinical perspective or a medicine making perspective or formulating perspective.
Wow. No shortage of stuff to do, huh?
Well, yeah, there's more than that, but I just wanted to limit it to this. I want to have some fiction that's been partially written that I need to expand out. There's kind of edutainment also in the world of plant medicine as well, but like post-apocalyptic, not that far in the future maybe type fiction that I'm working on. So I'd like to branch into that eventually, because I think that's something that would be fun to do. Creative. Like I used to be a musician, and I haven't touched music for over 15 years, but it would be nice to do something, pull something creative back into my life.
Nice. Well, I'm like, as I said, this is an incredible place, and this is an amazing work, and I'm going to jump into this as much as they'll put up with me for the next however many number of years. And how can people get in touch with you?
The best way is to go to our websites. So you can go to herbalmedics.academy or thehumanpath.com or thehumanpath.net, or you can just search my name, Sam Coffman, Coffman, and maybe put the word herb in there or medicine or something, and it'll pop up. I have a book out called Herbal Medic. It's done real well with Story Publishing. It's like their third best-selling book the last couple of years. So it's, you know, my name is out there if you just look for it.
Yeah, yeah. And, you know, I would highly recommend anybody who's interested in any experienced TCM practitioners or herbalists who want to add another perspective to their tool chest to potentiate what they're doing, but also folks interested in taking care of the people they love and austere medicine, worst case scenarios, and just being in the wilderness and learning how to take care of yourself. Thank you.
Thank you.